More than 15 months after it was first reported, the Wuhan virus continues its rampage. It has infected more than 141 million people worldwide and claimed more than 3.01 million lives. The deadly virus has hit countries in waves, showing a resurgence just when things had started looking a little less gloomy. The direct consequences of the coronavirus pandemic are well known. It has affected the global economy, shut schools and offices, and brought the world to a standstill. It has destroyed families and caused unparalleled havoc in our lives. The coronavirus pandemic has burdened the healthcare systems of even the most advanced countries. The struggle for beds, oxygen, ventilators, personal protective equipment, trained medical professionals, vaccinations are all too known. However, what about the untold toll of the Wuhan virus? Medical attention has been focused on treating the affected patients and protecting others from infection, and rightfully so. As health systems around the world concentrate on fighting a pandemic, it can be hard to remember that other ailments exist. But what about those with non-COVID related diseases? In these trying times, those who are already sick with other ailments are among the most vulnerable. Let's look at figures from the United States. In 2020, COVID-19 was the cause or a contributing factor in the deaths of 377,883 people in the country. Meanwhile, cancer caused 598,932 deaths, and heart disease led to 690,882 deaths. The pandemic has resulted in the interruption of cancer care worldwide. COVID-19 has reduced the diagnosis of cardiovascular disease, sharply increasing mortality rates from heart disease. Experts believe COVID-19 has turned the clock back many years, if not decades, in the fight against other infectious diseases. And most worryingly, there has been an alarming decline in the number of children receiving life-saving vaccines around the world.
What you don't want is that kind of a scenario where people are dying not because of COVID-19, but because their health needs were not taken care of, and everyone was so focused on COVID-19. But I suspect we will see a few of that because everyone is so focused on COVID-19.
When 56-year-old Anita Watson was diagnosed with stage 4 breast cancer in December 2019, it turned her life upside down. It was a double whammy. While dealing with the brutal side effects of chemotherapy, she also had to deal with the fact that the overloaded health services in the UK said they can no longer consider her a priority.
Well, when coronavirus came into play, everything changed. I mean, the panic that goes through you is unbelievable, because you're dealing with a terminal diagnosis, you don't know how long you've got, and you're trying to deal with this on top of it. And I think the toughest part for me was when I went to see my consultant, my oncologist, and she had the horrible job, really, of having to be brutally honest and tell me that from now on, I would no longer be priority.
Cancer patients are disproportionately impacted by the pandemic. They are at an increased risk of infection because their immune systems are weakened. They are also more likely to die from COVID-19 once infected, and delaying or foregoing cancer treatment can be deadly for them too.
Well, I mean, when you're going through cancer, you all have a card, and that's mine. And that little card is your lifeline. So you know that if you've got any problems, if you feel ill, unwell, you can pick up the phone and get through to the chemotherapy ward, and they're going to treat you. They're going to sort it out straight away. Now, with coronavirus, and with them saying you're no longer priority, what that actually means is that, unfortunately, they, and quite rightly so, they have to treat the curable cases first.
Cancer is the second leading cause of death worldwide behind cardiovascular diseases. Experts believe, in many places affected by the pandemic, a substantial increase in the number of avoidable cancer deaths is to be expected.
Diagnostic delays due to the COVID-19 pandemic has also sharply increased mortality rates from heart disease. Experts say this is because many people who needed care avoided hospitals due to fear of getting COVID-19. Additionally, for those with a heart condition, becoming infected with the coronavirus is more likely to lead to serious illness. Researchers in Oregon and Washington state, two of the worst hit areas in the United States, found that people who suffered a severe heart attack were more than twice as likely to die from it. Staying at home in isolation while stressed can also lead to poor eating habits. And people getting very little exercise and leaning more heavily on substances such as alcohol, all of which is bad for your heart. It is important to remember that though COVID-19 is the biggest global health crisis of our times, heart disease remains the leading cause of death. Symptoms of a heart attack should not be brushed off, and seeking timely aid is key to saving lives.
Here are the findings of a report called Direct and Indirect Effects of the COVID-19 Pandemic and Response in South Asia by Unicef, World Health Organization and the United Nations Population Fund. It states that the healthcare disruptions caused by COVID-19 could have a devastating impact on child mortality. Drastic cuts in the availability and use of essential public health services across South Asia due to COVID-19 may have contributed to an estimated 228,000 additional child deaths in 2020 and an additional 11,000 maternal deaths.
We need to intervene now and ensure that at least essential services to those who need it are available. It's understandable that, a lot of resources will be diverted to COVID-19 right now. But having said that, it should not be at the cost of core essential services which the health system should be running. So things like, care for those who are vulnerable, immunization, pregnancy care, maternal and child health care, ensuring that elderly have access to services, those with cancer or other serious conditions have access to care.
The report also underlined that children in rural areas and poorer households are less likely to access remote learning. School children are paying the price for the Wuhan virus. As a result of prolonged school closures, almost 9 million primary and secondary school children are expected to permanently drop out. And that's not all. While Herculean efforts are being made to produce, distribute and administer coronavirus vaccines, the number of children vaccinated against infections has decreased drastically since the COVID-19 pandemic started. The childhood immunization program protects against these diseases. Whooping cough, measles, German measles, meningococcal C, pneumococcal disease, chickenpox, tetanus, mumps, polio, diphtheria, rotavirus, hepatitis. In Europe, when the first coronavirus lockdown came into effect in March 2020, doctors noticed a decline in the rates of children coming for their childhood vaccinations. People have been avoiding appointments out of fear that they or their children could catch the coronavirus at a medical facility. It's the same story everywhere. Experts believe a steep drop in childhood vaccination rates is putting the US at risk of losing herd immunity against highly contagious diseases, including polio, whooping cough, and measles.
The impact is worse in developing countries.
Millions of children have been denied life-saving vaccines. In May 2020, data collected by Unicef found that immunization programs had been substantially hindered in at least 68 countries, leaving 80 million children under the age of 1 unprotected. The impact of these disruptions on children's health will be felt for years to come.
The world has been waging a war on the Wuhan virus, but its defenses in other, older wars are faltering. A new report by Global Fund shows COVID-19 has massively disrupted health systems and health service delivery for AIDS, tuberculosis, and malaria in low- and middle-income countries in Africa and Asia. Although it's curable and preventable, tuberculosis is still the leading cause of death from a single infectious agent. Over 5,000 women, men and children die each day from tuberculosis. Like COVID-19, tuberculosis is an airborne disease. It is treated with antibiotic drugs and takes about 6 months to treat. COVID-19 has impacted how TB can be treated. In fact, the WHO has predicted that between 2020 and 2025, an additional 1.4 million TB deaths could be registered as direct consequence of the COVID-19 pandemic. The COVID-19 pandemic has caused profound disruptions in the fight against HIV/AIDS too. Around 38 million people live with HIV worldwide. The global HIV response is based on potent antiviral drugs, aggressive testing, and inventive public education campaigns, but the pandemic has thrown this in disarray. As countries are forced to shift their focus on treating COVID-19, many other diseases are getting neglected. Did you know that 14th April 2021 was observed as World Chagas Disease Day?
Chagas disease affects 6 to 7 million people a year across Latin America. It is a silent disease. It affects the poorest, the most vulnerable, and kills slowly.
Despite high rates of morbidity, only 7% of people with Chagas disease are diagnosed and only 1% receive appropriate care. COVID-19 has made things worse. Patients infected with the disease are also at risk of severe COVID-19 manifestations. In addition, diversion of resources to fight the pandemic redoubled pressure on healthcare facilities. And patient concerns about contracting COVID-19 when visiting health centers pose new challenges for the fight against Chagas. While most cases still occur in Latin America, the disease is increasingly spreading to other geographies. Cases now appear in places such as the United States, Europe, Canada, Japan, and Australia. The prevention programs for many diseases, including malaria, have been knocked backwards. Look at this data that examines disruption patterns caused by COVID-19 from April to September 2020 compared to the same 6-month period in 2019. Malaria diagnosis fell by 31%, HIV testing fell 41%, TB referrals declined by 59%, antenatal care visits fell by 43%. The coronavirus outbreak has created many unknowns for pregnant women, so much so that a Brazilian health ministry official has asked women to delay getting pregnant until the worst of the pandemic passes, saying the virus variant that is devastating the South American country appears to affect expectant mothers more than earlier versions of the virus.
If possible, delay the pregnancy a little until a better time, and you can have a problem-free pregnancy.
The recommendation comes as Brazil continues to be one of the global epicenters of the pandemic. The P1 variant, first discovered in the Amazon city of Manaus, has quickly become dominant in Brazil. It is thought to be a major factor behind a massive second wave of infections that has brought the country's death toll to over 350,000.
Brazil's outbreak is increasingly affecting younger people, with hospital data showing that in March more than half of all patients in intensive care were aged 40 or younger. The surge in COVID-19 cases has also left hospitals short of sedatives needed for patients who require mechanical ventilation. Hospitals are buckling under the strain, and stocks of drugs needed for incubating severely ill patients are running perilously low, with Brazil turning to international partners for help with emergency supplies. The COVID-19 pandemic has also tested global medicine supply chains like never before. Even as Cuba tries to become the first country in Latin America to develop its own COVID-19 vaccine, the country is suffering acute shortages of basic medicines amid its worst economic crisis in decades. This is Diana Rodriguez. She says her son is overwhelmed with scabies, but she has not been able to find any treatments prescribed by their doctor at the poorly stocked pharmacies in Havana.
He gets pimples. Sometimes they go away, they come back over time and so on. Right now, it's back in full.
Did you look for medicine in the pharmacy?
There isn't any. They sent us benzyl benzoate. The other medicine they sent us is white in color. That's for itching too. That used to be in all pharmacies, and now there isn't any. So I'm using herbs.
Cubans have also set up groups on social media to barter medicines or other products, while the black market is thriving on the streets and online. Though drug supply chain vulnerabilities have been plaguing many countries in the past few years, things have worsened during the pandemic. COVID-19 has exposed and magnified weaknesses within healthcare systems. The hidden toll of the COVID-19 pandemic is far-reaching, with devastating effects on individuals, communities, and societies across the world.
I think there's a profound impact, and I believe it's also going to be a very long felt impact. It's not going to be something people just get over quickly as a result of this experience. So the anxiety we believe is a result of the fear of the unknown and uncertainty surrounding the pandemic, as well as loss of control. People didn't really have a great deal of understanding of how it spread and how they could control it. So that created a heightened sense of anxiety. We actually saw a lot of panic attacks. People who contacted us in the throes of a panic attack, and we were able to talk them through that to normalize their situation for them a bit. Now they're speaking more about depression and isolation.
Isolation, loneliness, fear of infection, these are the side effects of the coronavirus pandemic, and they are wreaking havoc on the mental health of not just the general population, but also those caring for them.
What all of seeing everything done and doing everything we've done, what is it going to do to us? The anxieties, the PTSD, the experience of death and dying. Most people haven't seen death and dying like this. A couple people a day under your care, that's not normal. Seeing one every now and then is not even normal when we're normally caring for patients.
For them, everything applies. There's the depression, there's the anxiety, there's the feeling of isolation, because often they have to be removed from being in the same home environment with their family because of the threat. But the imminent fear and physical risk to their health because of the coronavirus is very real. And we're beginning to see them showing the signs of trauma, which is really a perceived or realized threat to one's physical well-being. And that's going to be something that has far-reaching consequences as well.
With curfews, closures, and lockdowns set to drag for most part of 2021 as well, mental health professionals are growing increasingly alarmed about the deteriorating mental state of young people. Pandemic lockdown measures, including school closings, have been traumatic for children. One thing is certain. Countries must invest in and expand mental health services to cope with the effects of the pandemic. France is offering relief to children who have endured mental health issues as a result of the coronavirus pandemic. Children from age 3 to 17 could qualify for 10 free counseling sessions with a doctor's prescription. Coronavirus has also brought hunger to millions of people around the world. It has increased food insecurity in almost every country by reducing incomes and disrupting food supply chains. Brazil is one of the world's most important agricultural producers, but millions of people in Latin America's biggest country are struggling to put food on the table. A charitable organization has begun distributing basic food parcels to slums in the city of Sao Paulo.
I thank God because today I need it. I'm a widow. I have no help. I have nothing.
This action of food donation in the slum is very important because it is giving the option for these residents to be able to eat for at least 1 month.
The UN warns 36 countries could experience famines in 2021, pushing an additional 130 million people to the brink of starvation. We have shown you how the Wuhan virus has disproportionately impacted those who are the most vulnerable in our society, be it children, the economically deprived, or those already struggling to cope with chronic diseases. The scourge of COVID-19 continues to ravage lives, and its consequences will be felt for years to come.